Welcome to your Cleft Rhinoplasty pre-op teaching video. Now, 2 weeks before surgery, it's important to stop all blood thinners and herbal supplements because those herbal supplements likely have not been tested with anesthesia. The common blood thinners are aspirin, ibuprofen, fish oil, and vitamin E. If you drink alcohol, smoke, or vape, it's also good to stop these 2 weeks before surgery. You want to review all of your written material, watch this video, create a question list, and lab work is not super common in our patient population. For women or girls that are between the ages of 52 and 12, they will require a pregnancy test that is done at the hospital. Now, a great way to prepare for this surgery is also to have your nasal hairs waxed. This sounds super painful, but it really isn't. And when you get those hairs out of your nose, there's a lot less crusting afterwards, which makes recovery much nicer. You can do this anywhere from 1 to 4 days prior to your surgery. And after they do it, they put wax on a little stick, put it in your nose, and yank it. Make sure that you ask them to look in there a second time to be sure they got all the hair, because sometimes they have to do this more than one time to be sure you're nice and clean. So these are a bunch of over-the-counter medications that are great to have around the time of surgery. Tylenol, which we use for pain, Dramamine or Bonine, which are over-the-counter anti-nausea medications, an antacid like Tums or Pepcid, and an antihistamine like Zyrtec or Claritin and Benadryl. Also smart to have something like a humidifier or cold air vaporizer, some gauze pads, and maybe some paper tape, cold compresses for your eyes like those little gel packs that you can put in the freezer, a wedge or extra pillows so you can sleep with the head of the bed elevated, some nasal spray, and even a NeilMed or Neti Pot nasal irrigation system that you can find at like Walgreens or King Soopers or something like that, which can be used more long term to irrigate your nose and keep it clean, some Aquaphor, which is like Vaseline, and if you are planning to have ear cartilage removed, using a travel pillow so when you start sleeping on your sides makes it more comfortable on your ear. Now, in our office, if you would like to purchase something called Arnica Forte, it's a homeopathic medication to help speed with healing. It does contain pineapple, papaya, and traces of wheat, so if you have any of these food allergies, you'll want to skip it. You can start it the night before surgery and continue it twice a day until gone to help with bruising and swelling. You can also purchase Arnica and bromelain separately at a health food store. It's the bromelain that does have the pineapple and papaya in it, and you can start these the night before surgery as well. We will give you your prescription medications at your pre-op appointment, and fingers crossed someday we may be able to electronically send these to the pharmacy. It will likely include an antibiotic, an anti-inflammatory, a painkiller, and a prescription strength medication for nausea. Now, antibiotics are started at the time of surgery through your IV, and you will start taking your prescription once you're home. You'll continue them until the internal splints are removed, or about 1 week. Now, in the future, maybe we won't be writing for antibiotics because there are some medical articles coming out saying it may not be important, but right now we still are using them for all rhinoplasty surgery. Common names of these prescriptions are Keflex or Cephalexin, doxycycline, or clindamycin, and we'll make a choice based on drug allergies. Tylenol is also used for pain after surgery, and it's important for you to know that Tylenol comes as a regular strength pill, which is 325 milligrams, or an extra strength pill, which is 500 milligrams. For people who are of adult weight, or say over 90 to 100 pounds, we recommend taking 1,000 milligrams 3 times a day for at least the first few days after surgery. You don't want to take more than 4,000 milligrams of Tylenol in a 24-hour period, and this is written on Tylenol bottles. So this is a medication we have you start the morning of surgery with a tiny sip of water before leaving for the hospital. Celebrex is a prescription-strength anti-inflammatory medication, and I like to describe this as designer ibuprofen because each of these pills lasts for a whole 24 hours and it causes less bleeding than the other non-steroidal anti-inflammatories like Motrin. This is a medication that only needs to be taken as needed. The dose is based on your age, weight, and kidney function. For most normal young adults, anyone under the age of 65, you can take up to 2 of these a day depending on how much pain you're having. This is also a medication that we like to start the morning of surgery, taking 2 of them with a tiny sip of water before you leave for the hospital. And you can resume taking this 12 hours after surgery and continue it 1 to 2 times a day as needed for pain. Again, if you're over 65 years of age, you're only going to take this once a day as needed. So we'll also be giving you a prescription for a pain medication. Most commonly, this is going to be oxycodone, which is the same narcotic that's found in Percocet. And you can take one of these every 4 hours as needed. Now, if your pain is pretty severe and an hour later you're not getting relief, you can take a second one, but we don't want you doing this for any prolonged period of time. We do have other options if oxycodone doesn't agree with you. We have something weaker called Ultram or Tramadol that you'll take on the same schedule. And also for some people, Norco, which used to be called Vicodin, is also preferred. So it's important to know that this one does have Tylenol in it. So you do have to do the math and make sure you don't take too much Tylenol. Also important to note, we can't phone narcotics in as a refill. We can phone in Ultram. And honestly, most people don't ever go through their first prescription. Now, it's really the patient who should decide if they need to take some pain medication and when. Our goals of pain control are to decrease moderate to severe pain to something that's more tolerable, not to make you pain-free. Make sure that you're not just taking these pain medications because you're afraid of the pain, because they do have a lot of side effects, including nausea, oversedation, a decreased respiratory drive, itchiness, constipation, and addiction. I'm also going to give you a prescription anti-nausea medication called Zofran ODT. The ODT stands for oral dissolving tablet. So all you need to do is put one of these under your tongue and it's going to dissolve and work for you. At the hospital, they'll also give you a scopolamine patch, which looks like a little round spot bandage. And this also works for 3 days. Since we're working on your face, they'll put it on your arm under a piece of sticky saran wrap. It also has some side effects, including dry mouth, blurry vision, urine retention, and in older patients, it can cause confusion. When you're ready to take this off, make sure you wash the skin where it was with soap and water and a washcloth, and wash your hands to throw that washcloth in the laundry. When you throw the scopolamine patch away, make sure it's not at a place where a pet can get to it, because if they ate that, it could make them sick. Remember the Dramamine or Bonine we recommended that you purchase? You can use one of those for nausea too. And the good thing is if you're feeling really pukey, you can take all of these together. So if you start with one and it didn't work, you can move on to another safely. Night before surgery, it's important for you to understand your NPO orders. And what that means is when's the last time you can safely eat or drink before surgery. So for food and full liquids, which include things like milk or a latte or orange juice, you can't have any of that for 8 hours prior to your surgery. You can continue to have clear liquids for up to 4 hours before your surgery. Clear liquids include water, Gatorade, apple juice, tea, or black coffee, and you can put sugar in that. You can also have clear Jell-O that doesn't have fruit or marshmallows in it up until 4 hours prior to your surgery. And we know that people that have a little sugar in their system, and if they're used to having caffeine every morning, a little caffeine in their system, that can actually help them to wake up feeling better after surgery. If you did get the Arnica Forte or Arnica and bromelain, you can also start that the night before surgery. Make sure you know your arrival time and place, review your instructions, and know that you might get a phone call from anesthesia. So if you see an unknown call coming through, that may be who it is. On the morning of surgery, take a long and lovely shower because that's going to be your last one for about a week. Don't put on any face lotion or makeup, and if you do have long hair, bring a couple ponytail holders because I may need to braid your hair out of the way. Wear easy clothes like a hoodie that you can just put on and zip up, and maybe something like sweatpants. If you're adult weight, like over 90 to 100 pounds, these are the medications that we're going to recommend you take the morning of surgery with a tiny sip of water. And that's 1,000 milligrams of Tylenol, 2 Celebrex, a Dramamine or a Meclizine. And for people on regular prescriptions, we're only going to have you do crucial medications that morning, and we'll go over those with you at the time of your pre-op. If you're a tiny little person, we may have to give you some pediatric dosing for these medications. Considered an outpatient surgery, so you should be able to go home. But if you had a Also, we're going to send you home with what we call parting gifts. There'll be some antibiotic ointment left over from your surgery, also a bottle of generic Afrin, and maybe an eye gel that we use to just protect your eyes during surgery. You don't really need to use that Afrin or Genteel. We just hate throwing valuable stuff away. You can put that antibiotic ointment on your nose sutures 2 to 3 times a day. And after the first couple of days, like 48 hours or 2 to 3 days, you can switch over to Aquaphor if that antibiotic ointment is bothering you, because sometimes this can make people's skin a little red and rashy. Keep that diet really light the first night and the first day after surgery. I always say don't eat anything you're not willing to throw up. So you may want to just go with lighter foods that aren't too spicy. Remember, we don't want any straining or exertion. If you also had a cleft lip revision and you have sutures in your lip, you can treat these just like the nasal sutures by putting some antibiotic ointment on them a couple of times a day. If you do have those sutures in your lip, we'll likely have an additional follow-up appointment for you at 4 days after surgery where we take those stitches out, and then you'll come back again at a week after surgery for your nasal splint and the splints inside. So again, remember, you have to keep everything dry until your follow-up appointment where we take those nasal splints off. If we use Dermabond or medical super glue, which sometimes we use if it's hard for people to come in for follow-ups, you won't need to use any ointment on that glue. If you have stitches in the pink part of your lip, like where you put chapstick or lipstick, you can put a super tiny dot of antibiotic ointment or Aquaphor there. We'll go over those instructions with you after your surgery before you leave the hospital. If we needed to take an ear cartilage graft, I may use a little pressure dressing at the time of surgery, which you can remove the night of surgery or the next day. I usually close those incisions also with that medical super glue Dermabond on the incision behind the ear, so it really requires no care. It's definitely going to look bruised, but it shouldn't have excessive bulging like somebody put a rubber ball in your ear. It's going to be super tender, so you don't want to bump it. And if you start sleeping on your side, put it in the center of a travel pillow so there's no pressure on your ear. And that may be helpful even up to a couple of months after surgery. Now you're going to have a splint most likely on the outside of your nose and also on the inside of your nose. And again, these come off 7 to 8 days after surgery. So we want to keep these dry so they don't come off too early. So when it comes to bathing, we need you to keep that splint dry. So a shower, even if you keep your face dry, is probably going to be too steamy, and it's going to make the glue separate and make that splint come off too early. So a bath is generally fine as long as you didn't have a body procedure done at the same time. Now, at 7 to 8 days after surgery, the day you're coming back in to get your splint off, we might even want you to take a shower because you're going to be pretty stinky. So feel free to take a shower just before your appointment when you're coming in to get your splint off. Now, what's normal after a surgery like this? There's going to be some pain, and oftentimes that's like a headache. Again, you have your pain medication, and it should get much better every day. There's also going to be some bloody drainage that looks like a bloody, runny nose, but it shouldn't be drip, 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 running down the back of your throat continually that looks like dark blood. It probably will look more like a runny nose that's more pink colored or sort of a light colored blood, and that may go on for several days. You're going to be pretty swollen. Sometimes people can't even open their eyes right away, and that swelling should get better over the first couple days, but you may notice the bruising around your eyes actually getting worse. And again, we did talk about vomiting. Some people will swallow blood after this surgery, and we make bad vampires. We will throw that up pretty darn quickly. The good thing is that it usually makes you feel tremendously better once you've had that first throw up, but take it easy on what you're eating until you're sure you're feeling better. What can be concerning after surgery is a fever. Low grade, 99 or 100 won't be scary to us, but if it starts creeping up towards 101, like if it gets to 100.8 or 101, probably a good idea to give us a call. Also, if you start with a rash on your body, that could be an allergic reaction to a medication. So we want you to stop taking your all of your medications, start taking those antihistamines like the Zyrtec or Claritin and Benadryl, and give us a call immediately. You shouldn't have chest pain or shortness of breath after a surgery like this. Definitely a stuffy nose, but if you have a sudden onset of chest pain or shortness of breath, that could be a sign of a medical emergency, so call us. And if you start bleeding later on down the line, that is something new and extremely heavy. We need to know about that as well. Now, you can drive if you have a driver's license, and for most patients, it's when they're off their narcotic medications, and that's typically going to be in less than a week. Use good judgment because you might not have great reaction time immediately after surgery. At your first follow-up, again, which is at 7 to 8 days after surgery, you can shower right before that appointment if we're taking your splints off. And taking those splints out is sometimes not very much fun, but boy, does it feel good once they are out. After we take the splint off the outside of your nose, you may get a good look at what your nose looks like, but it is still very swollen, and that swelling is going to get worse within a couple of minutes to hours after we take that splint off. And it is going to take up to a year to 2 years for that swelling to go all the way down. We'll also talk about what you can do for scar care at this appointment, and we recommend people start using their scar care at about 2 weeks. Remember, no heavy nose blowing for about 2 weeks, and if you have to sneeze, sneeze through an open mouth. Saline nasal spray can help get those kind of crusty boogers out of your nose while those sutures are dissolving, and Neilmed or neti pot, which is used with distilled water, can be used more long-term to keep your nasal passages clear. If you wear glasses, we don't want the weight of those glasses on your nose for 2 weeks after surgery, so be sure you tape those to your forehead so that you'll look like a good nerd. No exercise for anywhere from 2 to 4 weeks after surgery. Light exercise like jogging can be at 2 weeks, but if you do things, heavy exercise like CrossFit, you may want to wait a whole 4 weeks after surgery. Also, if you do contact sports where you might get banged in the face, we want you to protect your nose for 6 weeks, so you have to plan accordingly. Your second follow-up may be as early as 2 weeks or maybe several months after surgery. If you see any residual blue sutures that we didn't get out at your first appointment, make sure you come back so we can get those. Again, you're going to have swelling that may last 12, 18, 24 months, so you do need to be patient. During the healing phase, usually starting about 2 to 3 weeks after surgery, some people like using these little nasal dilators or splints that can be purchased on Amazon, which can help with breathing and also to help maintain your nostril shape. All right, you are prepared. You have planned ahead. Be sure to bring your questions in, educate your caregivers, take the time you need to heal, and follow your instructions.